Having strong One Health surveillance systems for antimicrobial resistance is one of the pillars to tackle this global health threat. Currently, the European Union coordinates antimicrobial resistance surveillance through two of its agencies. In the medical sector, the ECDC monitors AMR in diseased individuals through the EARS-net and the FWD-net. In the animal and food sectors, the EFSA monitors AMR in zoonotic and commensal bacteria from healthy food-producing animals and food thereof. The monitoring of EFSA provides useful information to assess the risk of AMR transmission from animals to humans through the food chain.
It is necessary to complement the current monitoring system by an AMR surveillance component covering bacterial pathogens of animals. These bacteria currently represent a major surveillance gap in the One Health strategy of the EU to tackle AMR. It is also necessary to start monitoring AMR in companion animals.
Current antimicrobial resistance surveillance efforts have got limited help to veterinary practitioners and policymakers seeking to improve antimicrobial stewardship in animals. Monitoring AMR in bacterial pathogens of animals in Europe could make a difference in the fight against AMR.
Several European countries have already set up national surveillance systems of AMR in clinical animal isolates, yet they are highly diverse and fragmented. Other countries are also in the process of setting up their surveillance system, but without any European framework. Many other European countries currently lack AMR surveillance systems in diseased animals. There is an urgent need to build the European Antimicrobial Resistance Surveillance Network in veterinary medicine, EARS-VET. By complementing and integrating with AMR monitoring systems of the ECDC and EFSA, EARS-VET could represent a major step towards a stronger One Health strategy for AMR surveillance.
EU-JAMRAI has set up a multidisciplinary group of 30 experts from 14 European countries. Together and in consultation with relevant stakeholders, we have developed an EARS-VET surveillance framework.
The main objectives of EARS-VET would be: inform on AMR occurrence in specific animal pathogens, contribute to the development of evidence-based guidelines for antimicrobial prescriptions in animals, investigate direct links between antimicrobial consumption and AMR, support risk assessment of human exposure to AMR from animals via non-food related routes, provide timely information for policymakers and medicines agencies, contribute to estimating the burden of AMR in the animal sector. EARS-VET would operate as a network of national surveillance systems of AMR in diseased animals, similarly to EARS-net in the human sector. It has been designed following a bottom-up approach, so that it takes into account what is relevant and feasible to monitor for national surveillance systems. Regarding the EARS-VET surveillance scope, it was agreed to include 220 combinations of animal species, production types, specimens, bacterial species, and antibiotics of interest to the animal health and human health. The group of experts discussed a harmonisation strategy and defined antimicrobial susceptibility testing standards. It was also agreed to collect quantitative AMR data.
The next steps will consist in launching an EARS-VET pilot phase. Participating countries will start to share and jointly analyze their data to finally produce the first EARS-VET surveillance report.
To ensure the sustainability of EARS-VET, we need strong political commitment. On the short term, we urge EU and national decision makers to provide financial support for the EARS-VET pilot phase, and we encourage member states to join this initiative.
On the long term, EARS-VET could be taken over by a EU body that receives the mandate to coordinate AMR surveillance in diseased animals. This would ensure the integration of EARS-VET within the European landscape and contribute to achieving a stronger One Health surveillance of AMR.
In human health, the antimicrobial resistance and antimicrobial consumption data from European countries is shared with the ECDC and assessed on a yearly basis. In order to shorten the time gap between data collection and its assessment, EU-JAMRAI has piloted a near real-time surveillance system. For a 2.5-year period, 17 partners from 11 countries participated in the study, collecting 41 indicators each trimester. Data was provided from hospitals and primary care at local, regional or national levels.
Our aim with this study is to strengthen the current surveillance system in human health. Increasing the frequency of antimicrobial resistance and antimicrobial consumption data collection will help healthcare centers, health systems, member states gain advantage in the fight against antimicrobial resistance towards better health outcomes in the population.
In addition to increasing the frequency of data collection, this quarterly-based surveillance system has introduced new indicators to increase the knowledge of antimicrobial resistance and antimicrobial consumption from healthcare centres. This allows each healthcare centre to monitor the evolution of their own data and carry out interventions on a timelier manner at local, regional, national or European level.
The results of this pilot show that the implementation of a near real-time surveillance system in the EU is possible. The requirements to make it a reality are more institutional support, dedicating human resources, coordination of microbiological and antimicrobial consumption data sources, which implies more homogeneous indicators and modern integrated IT systems.